We interviewed Harvey Wiesenberg, New York State Assemblyman and an advocate for the rights of the mentally challenged, on this issue.
So if the family can't pay for them to go into nursing home, does the government do that? Or?
Yes, absolutely. That's their obligation. It's
right.
part of Medicaid.
Okay.
And the answer is that, as I said before, every person is entitled to dignity and respect.
How are government-funded facilities operated in the past?
Late 60s and 70s, they found these institutions to be basically criminal. They were starving people, they were short-staffed. They would sedate these people who have a disability, sitting in a wheelchair, looking at a blank wall. Nobody's talking to them, nobody's socializing with them. These children were never hugged, kissed, touched, nothing. How can they, what does it do to your mind?
Yeah.
How have government-funded nursing facilities for the mentally challenged changed over recent years?
We've come a long way because in the years that we've been involved ourselves, my wife and I, for over 50 years, that we've been involved, you see the changes, the beautiful homes, the one-on-one situations that you have with direct care service professionals have the hardest job in the world, taking care of another person, the lowest paid, and who wants this job?
Continues. John Dicken is the Healthcare Issues Director at the Government Accountability Office. Welcome to the program, sir.
Good morning.
What is the current status of nursing homes that come under CMS?
Well, what we found, really the bottom line, what we found is that state inspections of nursing homes often miss serious deficiencies. States will inspect nursing homes on average about once a year, and in 1 of 5 nursing homes they found serious deficiencies where residents have been harmed. Things like pressure sores or improper nutrition or hydration. Our report this week found that this may actually understate the problem, that there are a number of times that state inspectors are missing serious deficiencies that are harming residents. We actually found that in about 1,000 cases that were reviewed for over a 5-year period, about 15% of the time, the state missed a serious deficiency that they should have identified at that time.
Are they missing these deficiencies because they're not good enough inspectors, or are they not reporting deficiencies because they don't want to get in trouble with the feds and other people that are going to come in behind them and say, look, this is what you missed?
I think there's a variety of issues as to why there may be some deficiencies that are missed. Some of it may deal with the training or the resources or the availability. State inspectors are working very hard to try to look at residents, nursing homes, and facilities, but the standards often will require that issues that they may overlook or miss, and so that may be training or the inexperience of surveyors.
Now, is it because the standards are different from state to state that this is a problem, that there's no overarching sort of federal requirements for the nursing home industry per se?
Well, there's a shared federal and state oversight of nursing homes, and there are standard national standards for nursing homes participating in either the Medicare or the Medicaid program. So states are inspecting to meet these consistent federal requirements, but each state will have their own group of inspectors that will go into the nursing homes to do those inspections. And we did see quite a bit of variation across states as to what extent they either find serious care problems or, in our most recent report, that they may be missing those serious care problems.
Who was it that asked for GAO to do this investigation?
We're a congressional agency, and so this work was requested by Senator Grassley, who is the ranking Republican on the Senate Finance Committee, and Senator Cole as the chairman of the Special Committee on Aging.
Earlier this week, there was a hearing in the House Energy and Commerce Committee in the Investigation Subcommittee, and they made reference to this report. What is it that they were talking about, and what is it that the House and the Senate want to do in order to rectify this situation?
Right, the House had a hearing earlier this week that looked at a number of issues in enforcement of nursing homes. They heard from the Attorney General in Connecticut that talked about issues with certain chains in Connecticut, did refer to our report and work done by the Inspector General. There has been some legislation proposed both in the Senate by Senators Grassley and Cole and in the House that would increase enforcement actions on nursing homes and try to provide more information, for example, on the ownership of nursing homes.
We're talking with John Dicken. He's the Healthcare and Issues Director at the Government Accountability Office. And